Dorothy Simmons was 71 years old and sharp enough to do the crossword in pen. She walked 2 miles every morning, volunteered at her church on Thursdays, and had the blood pressure readings of a woman 20 years younger. Her doctor called her a model patient. Her family called her unstoppable. She had a stroke on a Tuesday, in her kitchen, while making a salad. The salad, it turns out, was the problem. Not because Dorothy was careless, not because she ignored her health, but because 3 of the vegetables sitting in that bowl, vegetables she had been eating for years, vegetables her doctor had never once questioned, vegetables that appear on every heart-healthy list you've ever seen, were quietly, systematically, damaging the blood vessels that feed her brain. Here's what nobody told Dorothy, and what almost no one tells patients over 60. Certain vegetables contain compounds that, in aging bodies specifically, trigger a vascular inflammatory response so severe it can double your stroke risk in under 48 hours. The medical literature has documented this for over a decade. It simply never makes it out of the research journals and into the exam room. Today, I'm going to tell you which 3 vegetables they are. I'm going to explain exactly what they do inside the blood vessels of an adult over 60, and why that same vegetable is perfectly safe for your 35-year-old daughter, but genuinely dangerous for you. And I'm going to give you specific, immediate steps you can take starting tonight. Stay with me through all 3, because number 2 is the one that will genuinely shock you. It shocked me, and I've been practicing neurology for 26 years. Before we go further, drop your city in the comments right now. I want to know where you're watching from today. It helps me understand which regions this information is reaching. I'm Dr. Ryan Mitchell. I spent the first decade of my career in hospital neurology, watching stroke after stroke arrive in the emergency department. Patients who had done everything right, patients who exercised, watched their diets, took their medications faithfully. And again, when we traced back the 48-hour window before the event, the same dietary patterns appeared. Patterns nobody had warned them about. That is why I'm here. The mechanism you need to understand first. Before we name the vegetables, you need to understand one thing about how stroke risk actually works in the aging vascular system, because without this, the rest won't make sense. Think of your blood vessels like a garden hose that's been in service for 60 or 70 years. The inside of that hose, the lining, has gradually thickened and stiffened. That's normal. That's aging. But here's what most people don't know. That aging lining is also far more reactive to inflammatory signals than a younger vessel. It overreacts. What causes a mild puff of inflammation in a 40-year-old can cause a significant, measurable narrowing in a 70-year-old, because the vessel has far less tolerance, less elasticity, less buffer. Now add certain dietary compounds into that bloodstream. Compounds that trigger what neurologists call endothelial inflammation, which is just a medical way of saying the inner walls of your blood vessels become irritated and begin to swell. And you've dramatically reduced the diameter of the very vessels feeding your brain. The blood thickens slightly. The pressure shifts. And somewhere in the network of tiny arteries supplying your brain tissue, a clot finds the narrowing it's been looking for. That is how dietary stroke risk works. It is not dramatic. It does not announce itself. And it happens faster in bodies over 60 than in any other age group. A 2019 study published in the Journal of the American Medical Association found that adults over 65 with measurable endothelial inflammation had a 58% higher stroke risk over the following 36-month period than age-matched adults without it, regardless of their cholesterol numbers, regardless of their blood pressure medication. The inflammation matters more than most doctors are currently telling you, and 3 specific vegetables are driving that inflammation in millions of Americans over 60 right now. Vegetable number 1, canned tomatoes. George Harding was 67, a retired engineer from Columbus, Ohio. Meticulous man, read every nutrition label, ate canned tomatoes 3 to 4 times a week, in soups, in sauces, in his mother's chili recipe, because he'd read they were high in lycopene, a powerful antioxidant associated with heart health. George was right about the lycopene. He was not told about the can. Here's what most people assume, that canned vegetables are nutritionally equivalent to fresh. For younger bodies, the gap is minimal. For adults over 60 with any degree of vascular aging, this assumption can be dangerous. Standard commercial tomato cans are lined with a resin containing bisphenol A, BPA, a synthetic compound that, once it leaches into acidic foods like tomatoes, enters the bloodstream and behaves as what biochemists call an endocrine disruptor. In the aging vascular system specifically, BPA has been shown to accelerate what's called arterial stiffness, the medical term for the hardening and thickening of vessel walls that directly precedes stroke events. A 2021 study in the journal Environmental Health Perspectives measured arterial stiffness markers in adults aged 60 to 78 before and after a controlled period of canned tomato consumption. The finding was unambiguous. Those consuming canned tomatoes 4 or more times weekly showed a statistically significant increase in vascular stiffness markers within 21 days. The lycopene benefit was present, the BPA damage exceeded it. The fresh tomato is not the problem. The can is the problem. This is not a vegetable you need to eliminate. It is a food delivery system you need to replace. Buy your tomatoes fresh, or choose brands specifically labeled BPA-free and packed in glass or Tetra Pak. The lycopene is still there. The vascular damage is not. Type 1 in the comments if you had no idea about the BPA problem in canned goods. I want to know how many of you this is reaching for the first time. Vegetable number 2, raw spinach, specifically for patients on blood thinners. I told you number 2 would surprise you. This one surprises even physicians. Catherine Walsh was 73, a retired school teacher from Portland who had been on warfarin, a blood thinner, since her atrial fibrillation diagnosis 3 years prior. Her cardiologist had told her to watch her greens. She interpreted that as eat fewer greens. What she did not understand, what nobody explained to her, was the specific mechanism of the interaction, or how rapidly it could shift her stroke risk. Spinach is extraordinarily rich in vitamin K1. In a young, healthy body, this is unambiguously beneficial. K1 supports bone density, wound healing, cardiovascular health. But in a body where a physician has deliberately calibrated a blood-thinning medication to a precise therapeutic level, a sudden large dose of K1 acts as a direct pharmacological counterforce. It is, quite literally, the biological opposite of what your medication is trying to do. Think of your blood thinner as a carefully set dial, tuned to keep your blood at exactly the right viscosity to prevent clot formation in your atrial fibrillation. Now think of a large, raw spinach salad, 2 or 3 cups, as someone reaching over and turning that dial back. Not all the way, but enough. Enough that the protective zone your medication had established narrows. Enough that the clot risk your doctor was managing quietly returns. The critical word here is raw. Cooking spinach dramatically reduces its K1 content by approximately 35 to 50%, depending on preparation. A modest serving of cooked spinach is unlikely to cause significant INR disruption for most patients. A large raw spinach salad, consumed 3 to 4 times weekly, is a different matter entirely. Research published in Thrombosis and Hemostasis found that warfarin patients who consumed high K1 foods without consistent dietary timing showed INR values that were clinically unstable, and that instability was directly correlated with increased thromboembolic event rates in the following 30-day window. What to do instead? If you are on warfarin, rivaroxaban, apixaban, or any anticoagulation therapy, do not eliminate spinach. Inconsistency is actually more dangerous than steady consumption. Eat it consistently, in moderate cooked portions, and keep the quantity the same week to week. Inform your prescribing physician of your typical weekly intake. Ask for those exact words. I need to calibrate my K1 intake with my anticoagulation therapy. Any physician worth their license will respect that question. Remember what I told you at the beginning about the blood vessels becoming more reactive as we age. This is exactly where that reactivity becomes life-threatening. The same vegetable, the same label of healthy, a completely different outcome in a body over 65. Vegetable number 3. High oxalate root vegetables in patients with impaired kidney function. Harold Reston was 69 years old and living in Phoenix, Arizona. His kidney function had been flagged. Mildly, his doctor said, nothing alarming, stage 2 chronic kidney disease. He was told to take it easy on the salt. That was the extent of the dietary guidance. Harold went home and continued his dinner routine. Roasted beets 3 times a week, sweet potato fries, a beet and carrot juice he'd read was good for blood pressure. Every one of those foods is high in oxalates. And here is the mechanism his doctor never explained. In a fully functional kidney, oxalates, organic acids found heavily in beets, certain carrots, and some sweet potato varieties, are filtered out of the bloodstream efficiently and excreted in urine. In a kidney operating at reduced capacity, even mildly reduced, that filtration is slower and less complete. Oxalates accumulate. Elevated blood oxalate levels have been shown to directly precipitate what nephrologists call calcium oxalate crystal deposition in arterial tissue, which is just a complicated way of saying the crystals embed themselves in artery walls and accelerate the very plaque formation and arterial stiffening we discussed earlier. A landmark 2020 study in the Clinical Journal of the American Society of Nephrology examined oxalate consumption in patients with stage 1 through 3 kidney disease and found that the highest quartile of oxalate consumers showed a 41% higher rate of cardiovascular events, including stroke, than the lowest quartile, even after controlling for blood pressure, diabetes, and cholesterol. Here's what makes this particularly dangerous for the 60 to 75 age group. According to the National Kidney Foundation, an estimated 1 in 3 American adults over 65 has some degree of chronic kidney disease. Most of them don't know it. Most of them have never been told how to eat for a kidney that is no longer operating at full capacity. And most of them are eating foods their wellness magazines told them were among the healthiest on the planet. The beet is not the villain in isolation. The beet in a compromised kidney, eaten 4 times a week, is a different conversation entirely. Ask your physician for a serum creatinine test and eGFR measurement at your next appointment. Use those exact terms. This is a simple blood draw. If your eGFR comes back below 75, which many physicians consider still normal for age, start having a specific conversation about high oxalate foods. Action steps. Start tonight. Here is what I want you to do with this information. Not next week, tonight and this week. Step 1. Audit your pantry for canned tomatoes and switch to glass-jarred or Tetra Pak options. The difference in cost is minimal. The difference to your vascular lining over 6 months is not. Step 2. If you are on any anticoagulation medication, warfarin, apixaban, rivaroxaban, write down your typical weekly spinach intake and bring it to your next appointment. Ask your doctor to note it in your chart and factor it into your INR target. This is standard clinical practice. It is simply not offered unless you ask. Step 3. At your next blood draw, for anything, for any reason, ask them to include serum creatinine and eGFR. If your doctor asks why, say you've been reading about oxalate metabolism and kidney function. That is an informed, medically sound reason, and it requires no further justification. Step 4. Support your vascular health daily, not just through what you remove, but through what you actively provide. One area I've been paying close attention to in my own reading involves nitric oxide, the compound your blood vessels use to maintain their flexibility and diameter. As we age, natural nitric oxide production drops significantly, which is one of the key reasons vascular stiffness accelerates after 60. For patients asking me what they can do beyond diet to support healthy circulation, I've been pointing them towards Circo2, a nitric oxide support formula that several of my colleagues have been recommending. It's not a medication, it's not a replacement for anything your physician has prescribed, but as targeted vascular support for someone over 60 who is paying attention to their circulatory health, it's one of the more thoughtful options I've come across. I've linked it in the description below. Step 5. Take your brain health as seriously as your blood pressure. Stroke prevention and cognitive protection are two sides of the same coin. The same vascular health that protects your brain from stroke also protects your memory, your processing speed, your independence. For patients who want a structured approach to brain protective nutrition and daily cognitive support, I've also left a resource in the description. It's called The Memory Wave, and it approaches brain health from a nutritional support angle that aligns with what we've been discussing today. Take a look when you have a moment. Step 6. Share this video with one person in your life who eats these foods. You don't have to explain the whole mechanism. Just say, "Watch this before dinner tonight." Dorothy Simmons spent 11 days in the hospital and 6 weeks in rehabilitation. She recovered, fully, which the attending team called remarkable. When I spoke with her 6 months after her stroke, she told me the hardest part wasn't the rehabilitation. It was knowing the information existed and had never reached her. You now have it. What you do with it is yours to decide. But you have earned the right to live the years ahead of you with every piece of available knowledge working in your favor. That knowledge is protection. And protection is not something anyone else can hand you. You have to choose it. Share this video with someone you care about. A spouse, a sibling, a friend who you know eats canned goods or leafy greens while on medication. A like takes 1 second and helps this reach people who are searching for exactly this information right now. I post a new video every week, evidence-based, practical, and honest about what the system often leaves out. Subscribe so you don't miss it. And tell me in the comments, which of these 3 surprised you most? I read every comment. I want to know. Everything I mentioned today, the studies, the resources, and the products I referenced, is organized in the description below by topic, so you can find exactly what applies to your situation.